KwaZulu-Natal health authorities have raised concerns around the high number of teenage pregnancies in that province too over the Christmas weekend. This as KwaZulu-Natal health MEC Nomagugu Simelane visited new mothers and their babies at KwaDukuza's hospital in KwaDukuza. In fact, it's called General Justice Gizenga Mpanza Hospital.
We're coming to you from the General Justice Gizenga Mpanza Hospital here in KwaDukuza, where the MEC of Health here in the province, accompanied by the Deputy Minister of Home Affairs, Njabulo Nzuza, are welcoming Christmas babies. We don't know the number yet, but I have with me the MEC for Health here in the province, who's going to be telling us more. MEC, we thank you very much for your time. Just give us the number of the babies born on Christmas Day this year.
Thank you very much, Bongan, and thank you for coming. Today we have welcomed 47 babies. 23 of them are girls and 24 are boys. And of that number, 7 of them were actually born in this hospital, and we are quite excited about that. And as I indicated earlier on, we also have one mother who herself is a Christmas baby, so we are very excited, and we are going to be having an engagement with her. The worry though from that number is that we continue to have teenage pregnancies, or we continue to have teenage mothers or young mothers. We had a 15-year-old that gave birth in Prince Mshieni. We had 2 17-year-olds that gave birth in Manguzi, and 3 18-year-olds that gave birth in the province as well. The biggest worry there is not the year that they gave birth at, which is this year, but it's the fact that it means they got pregnant the previous year. So the 15-year-old means got pregnant when she was 14. And that's something that should worry us as a society. And we should make sure that those that impregnate our children, those that impregnate our young girls, must actually face the consequences. That is why we make a call to families to say, don't just welcome damages when someone who has impregnated your daughter brings damages, particularly a daughter that is a teenager. Make sure that the law takes its course, because that person is a rapist. When you have sex with a 13-year-old, when you have sex with a 14-year-old, that is statutory rape, despite the fact that you might think the 14-year-old has consented. There's no 14-year-old that has enough mental capacity to consent to that. But as an adult, when you engage in sexual activity with that child, you are responsible. And we are saying to the families, take responsibility, make sure that all those who actually engage on sexual activities with young kids face the consequences.
MEC, teenage pregnancy is not a new thing. It's been with us for years. Do we have maybe programs in place to make sure that we don't see the increase in teenage pregnancy?
Well, in the province of KwaZulu-Natal, we've had a discussion in the social cluster together with the justice cluster on how do we address the matter. Firstly, you need to bring in the Department of Social Development, you must have health, you must have SABC and a host of other departments to come together, Department of Education, to come together and have a concerted effort and one strategy to ensure that we deal with these issues. As a Department of Health, we can, as and when we have these young mothers for coming into our facilities, report to the police. But the problem, if we do that as a Department of Health, we run a risk of chasing them away and they start giving birth at home, and that will create more health problems. So just a once-off approach of getting the police involved is not a total solution. We need to have one strategy that we all implement. Hence, we are sitting together with all the clusters that I spoke about to try and come up with a long-lasting strategy on how do we address these issues, which includes a strategy of speaking to our young people while they are still at school, making them aware of what it means to get involved to get involved sexually when you are still young, because that is not just about your future, but it also have implications for you physically, because a 14-year-old is not ready to be a mother psychologically and physically. A 13-year-old is not ready to be a mother psychologically and physically, and those are the engagements we must have. So we, as a province of KwaZulu-Natal, we are sitting together trying to come up with a long-lasting solution. We don't want to implement solutions that might backfire. We don't want to implement solutions that are just going to be short-term, but we are putting our heads together to try and deal with the situation.
Thank you very much for your time, MEC. We also have the Deputy Minister of Home Affairs, Njabulo Nzuza. Minister, we thank you very much for your time. When you were speaking to us earlier, you mentioned there's parts of today is also to encourage these new mothers to make sure that they do register their kids with the Department of Home Affairs. Just speak to us about the challenges that you are facing when it comes to new mothers registering their children.
Well, we have had problems in the past where a mother will give birth in a hospital and then has to go to a Home Affairs office in order for them to register the birth of their children. But this obviously was not much of a working solution. We then decided to have as part of our early birth registration program, where we are encouraging mothers to register the birth of their children within 30 days. We then decided that we must have presence in hospitals at the point where the birth of a child happens, so that a mother can register the birth of a child instantly before they even leave that particular hospital. Because we must remember, for a child to be recognized legally and to be a person that exists in the country, they have to be registered in the National Population Register. And their first entry in the National Population Register, which satisfies them that they are now a bona fide citizen of South Africa, is a birth certificate with an identification number, which will then give that particular child access to all that the country has to offer. If you can imagine that that particular child can't have access to social welfare before they have their identity being sorted out, you cannot even put them as part of your medical aid beneficiaries up until such time that you register them as part of the National Population Register, and that is where they get their identification document. What we have also observed, and as part of our concern, is the unavailability of fathers on the birth certificates. We encourage fathers to show up. We only know of Jesus, who came through this earth through the intervention of the Holy Spirit, but all other children other than Jesus, they have fathers, and those fathers must come up and they must show up and appear on the birth certificates.
On the programs that you mentioned of making sure that these young mothers do register their children, you mentioned that you are now coming into hospitals, making sure that before they leave, the babies are registered. Are you seeing fruitful results?
Yes, we are seeing fruitful results. A majority of births now, they are being registered under early birth registration, which is within 30 days. More than 850,000 in the past year out of 1 million or so, that births that we were registering. And our presence, just in KZN alone, we are present in 50 hospitals or birth registration centers, and 3 of those, and 3 are actually private healthcare facilities. So we have expanded that. It makes it easier, because we no longer have a problem of an adult who comes and say, I'm a South African, but their parents have passed away. You can't verify if that particular person is really a South African. Because in South Africa, for you to get citizenship, it is not about being born in South Africa. It is about being born out of South African parents. And as a result, we have to make sure that we do the balance and checks to protect our own population register, such that the people who appear there are actually South African citizens who are eligible to be there. And we then have to do those checks and balances. But if a child is born here in the hospital, we capture the birth of that child as and when it happens. It allows for that child to live a better life for the rest of their lives.
Thank you very much for your time.
Thank you very much, sir.
Well, that was Njabulo, the Deputy Minister of Home Affairs. Also, earlier we spoke to the MEC of Health, Nomagugu, Simelane, just speaking to us about the different challenges they have when it comes to teenage pregnancy, and also mentioning that it's very important for young mothers to register their children, saying that they are on a campaign, or rather they are encouraging them to register them within 30 days.